there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. I'm going to be bringing you programs that will provide information about health issues relevant to our community. We will have physicians and healthcare specialists on the program who will tell you how to prevent those issues or get help if you already have them. In addition, we are pleased to introduce Medical Alert, announcements from the Mayo Clinic, a partner of KRMC. As you all know, there are enormous challenges currently being faced by healthcare. From increases in our insurance premiums to the state cutbacks in access and Medicare, the average consumer is scrambling to find ways to ensure that they have good health coverage. Now more than ever, it's important that we all take responsibility for our health. Prevention is the key to staying healthy, and I hope these programs will help you learn how to become a healthier individual. The topic for our program this week is Your Hearing. My guest today is Dr. Katie Brown, an audiologist with Kingman Regional Medical Center. I hope you'll stick around after these commercials because we've got a great show for you. Welcome back to Your Health Matters, brought to you by Kingman Regional Medical Center. My guest today is Dr. Katie Brown, audiologist here at KRMC. Welcome, Katie.
Thank you. It's good to be here.
Well, we're glad to have you on the show. So tell me, what does an audiologist do?
An audiologist is a specialist in the diagnosing and evaluating hearing and balance problems.
Wow.
We can also evaluate noise levels in workplaces that may be loud environments to work in to determine if the noise levels in those environments could be causing damage or harm. We can also fit and dispense hearing aids and discuss strategies with patients and counsel regarding strategies for listening more effectively to maximize understanding speech.
Can you help my husband with that?
I sure can.
So tell me, how did you become an audiologist?
Well, I got my doctorate at the University of Arizona, and how I came about audiology was almost by accident. Throughout school, I just kind of happened upon the field of audiology, and I thought it was fascinating, and so here I am today. I've worked at KRMC for about a year now, and it's been an absolutely wonderful experience.
Great, and it brought you back to Kingman.
It sure did. I grew up here. My family moved here in 1990, and I've been here ever since.
Great. Well, yeah, there's been a few changes since 1990, but
there sure has. We have Chili's now.
We have Chili's. Very good. Well, it's great to have you here in Kingman. It's a wonderful service that you brought that we didn't have before, so we're excited to have you on board and part of the KRMC team.
And I'm excited to be here.
Well, before we go any further, I wanted to show you a segment from Mayo Clinic's Medical Alert program entitled Audio Devices and Hearing, and then we can talk about it afterwards.
Great.
Outside onto any city street and you're likely to see people hooked up to a personal audio device. Every day, more and more people are using them. But have you ever wondered about the impact these music players have on your hearing? Experts at Mayo Clinic want to make sure you know where to set the volume so you can avoid any hearing damage. They're everywhere. Personal audio devices. Millions are plugged in. But can they hurt your hearing?
There certainly are levels that are safe for long periods of time, but that can quickly change as the level goes up.
Mayo Clinic audiologist Lindsay Wagner tests personal audio device volume levels in her office so people can be sure the levels are safe.
Might tickle a little bit here.
Dr. Wagner is concerned about two things: how loud the volume is.
It's pretty loud.
And how long you listen at that level.
50% on that volume wheel you can wear safely all day long if you wanted to, but if you go up to, let's say, 60 or 70% on your volume wheel, depending on the system that you're using, maybe you'd only be able to wear that safely for 4 hours.
That's because as volume levels go up, the amount of time you should wear the device goes down dramatically. This reading shows an average volume of 97 decibels.
I see that she can wear that for only about 30 minutes before putting her hearing at risk.
What happens to your ears is this. Music goes in through the eardrum to the middle ear bones and then to the inner ear, which is lined with tiny hair cells. Loud music can damage those hair cells, causing hearing loss. So if your ears hurt or ring, your hearing is at risk. The damage could be temporary, but if you listen to loud levels for too long, the damage could be permanent.
In most cases, it won't make you go completely deaf.
But it could make some voices and sounds hard to hear. The bottom line, be aware of how loud your volume setting is. And if you're concerned, see an audiologist to help you set safe levels. Be careful in places like the gym where there's a lot of background noise. If you crank it to drown out that noise, you could be setting it to levels that are dangerous to your hearing. Lindsay Wagner says personal audio devices are safe as long as you set the levels correctly. For Medical Edge, I'm Vivian Williams.
So tell me, Katie, what do you think about the information we just showed? Do you see a lot of that here?
I think it's a very interesting video that we just saw, and I do see a lot of people walking around with their iPods turned up so loud that I can hear it. The audiology department is out of the wellness center,
Oh, yes, a
and
lot of
there
it
are
there.
a lot of people with their personal radio or music devices listening within the wellness center to their music.
Yeah, they're on the treadmill or the stair climber or whatever, and
They sure
they're
are,
focused.
and if I can hear it, then I know that they can hear it, and that it very well could be causing damage to their hearing.
So how do you know if it's too loud and if you're actually causing damage to your...
That's a good question. There are safe listening levels, and how we determine what can cause damage to your hearing permanently is a formula that depends on the loudness of the music or the sound and how long you're exposed to that sound. So in general, if you're listening to an iPod type device, you're going to be able to listen for about 8 hours with the volume set at 50%. So that means with the volume control only halfway up for it to be safe for your hearing. And once you turn the volume all the way up, within minutes, it can cause permanent harm to your hearing.
Really?
Yes.
That fast?
Absolutely.
Well, I know that the ear is obviously a delicate instrument that I think we all kind of just take it for granted because they're just there. And we don't always think about what we're doing to them.
Absolutely. And I see that a lot. People say, well, I don't want to worry about hearing loss now, or no one ever told me I should be wearing hearing protection.
Right.
We have cells in our ears that pick up the sounds we hear. And once those cells are dead or damaged, they cannot be repaired or regenerated.
So it's not like skin cells that regenerate themselves and come back.
That's correct. So once they're gone, they're gone. And so it's very important. It's vital to preserve those cells at their healthiest so
Right.
that you can hear in a normal way throughout your lifetime.
That's good to know because I didn't know that. That's amazing. Now I know you brought a what do you call that? A sample of an ear.
Yes, I
A
brought my
scale.
ear.
So show us, I mean, like obviously our earplugs that we have on our iPads or iPods go right there. And what happens to that music?
Absolutely. So when sound is going through your ear, Jamie, the sound comes into your ear canal, and this part here is your eardrum, and it vibrates your eardrum.
Okay.
And behind your eardrum, there are 3 tiny little bones that vibrate when your eardrum vibrates.
Okay.
Those little bones send that vibration into your inner ear where those little cells are. And they're called hair cells because that's what they look like, just little hair
They're
cells
that
that
small.
wiggle around.
Okay.
And they're microscopic.
Wow.
Now, when a loud sound comes in, it smashes down on those hair cells,
Oh.
and that's what causes the damage.
Okay. So when you see someone that comes in and they've had that kind of damage done, what kind of things do you do what can you do to help them?
Well, a lot of times the damage is not permanent. When someone's exposed to a very loud sound, it might not cause immediate permanent damage.
Okay.
But it is additive over time, meaning that over time, if you're exposed to noise repeatedly that is damaging to your hearing, then you're more likely to develop hearing loss due to that noise exposure. Now, what I do with patients that come in with excessive noise exposure, the first thing I do is counsel them regarding the impact of noise and the detriments that noise can cause on their hearing. But then I also talk about options in regard to hearing aids and strategies for effective communication. All of those things are very important for anybody with hearing loss. And in some patients with hearing loss resulting from noise exposure, they also may experience tinnitus or ringing in the ears.
Oh, I know a couple of folks that have mentioned that to me, where they have that that's got to drive you crazy.
Absolutely, it does. It's very debilitating to some people, and it's something that is a result in some cases of excessive noise exposure and damage to the ear.
And is there anything you can do to help with that ringing in the ears?
There is no cure for ringing in the ears.
Okay.
However, there are things that have been shown to reduce the perception or the awareness of the ringing in the ears. There has been evidence that has shown wearing hearing aids can reduce your awareness of ringing. And so for people who also have hearing loss, that's a very good option. But then there are also other treatment strategies such as counseling or
When you say counseling, what do you mean by that? I mean, you just kind of help talk to them about what they're experiencing and...
In regard to tinnitus, a lot of the debilitation from tinnitus comes from the negative psychological effects of having it. So what I mean by that is that when someone has ringing in their ears that frustrates them, they concentrate on that ringing and they get more frustrated, and then they concentrate more on the ringing and get more frustrated.
So it's
a negative spiral. Exactly.
Okay, that makes
and
sense.
so sometimes counseling can help to break that cycle.
Help them learn to focus on something else besides that inner ear
Absolutely.
ringing.
So if you're focusing on gardening or listening to enjoyable music at safe levels or watching a television program that you enjoy, instead of concentrating on the tinnitus, that can reduce your frustration that's associated with the tinnitus and kind of break that negative loop.
Okay, well that's good to know. That's great information, Katie. We've got lots more to cover, so we'll be back right after this commercial break.